This conference will now be recorded.
Hi, everybody. Welcome to our May RMC support call. Good to see everybody. Um, so want to see David. I haven't seen you before. David, can you hear us? Yeah. Oh, still can't hear you on this side.
Yeah, David's having some audio problems. You could try, if you do have like a smartphone, there's the Go To app that might help fix if you came in on your phone.
Okay, while he's doing that,
What a shame.
want to go around the room and see if there's anything on anybody's mind. So, Nicola, good to see you. Anything
Hi.
you want to, yeah, anything you want to share or anything on your mind right now?
Um, I've obviously come on to see you guys. It's always nice to see you and check in. But I brought obviously David to obviously share his story and get some positive like feed from Andre and stuff. I've always talked about you, but he's never felt like he wanted to come on before. So I first got contact with David in 2021, I think it was. So and he's doing really well. So yeah, but hopefully he'll be able to tell you all about it. And obviously, Carissa, I've been following you this week with Carlos and stuff. I know you feel because it's been the same for me with Rick on the first. So it's tough, isn't it? It doesn't get easier, but thinking about you.
Thank you, Nicola. I appreciate it. And thank you for bringing David. I appreciate him joining the call. So, you know,
Yeah,
oh,
so it'd be good if he can share with you because I think he wants to. I think it'll be good for him.
nice. Hi, Pam. How are you? I do not hear anything. Can you hear us, Pam? Nothing on my end.
No, Pam's audio's not connected for some reason. I'm not sure why, because I can see that.
Mm, okay.
But
Oh,
Pam,
would it
if you
help?
can hear us, yeah, if you can hear us, feel free to post anything in the chat as well. There's
Hey,
Milton.
Milton.
You're on mute.
Okay. Hi, Lois.
Hi, how are you?
Good. Hey, Aisha.
I'm okay.
Okay, so we're just going around the
Mhm.
room to see what's on people's mind. Brian, is there anything you want to share or had anything on your mind that you wanted to discuss?
Actually, yeah, I actually have some pretty good news. I recently got scans about a few weeks ago, and I am officially Ned at the moment.
Yay! That is amazing. Yes. So
Yeah,
excited to hear. So,
thank
what are
you.
your plans? You have any plans?
Um, I don't have any specific plans. Dr. Masala wants to keep me on chemo at least until my next scan in probably like July, August-ish. And then from there, they'll either decide if they want to put me on a break or stop altogether. I don't know. It just depends what they see.
Sounds good.
Yeah,
Happy to hear.
yeah. It still hasn't hit yet, really, but it's getting there.
Good, good.
Brian also had a birthday. He's being shy, but he also had a birthday.
Yeah.
Oh, happy belated birthday.
Thank you. Thank you. Yeah.
Andre, is there anything on your mind or anything you wanted to discuss?
Um, First, I just want to say Happy Mother's Day to all the wonderful mothers out there, especially to my mom, because that was my caregiver during my R&D journey. So I just wanted to put that out there. Y'all mean so much. And Brian, I'm so proud of you, man. I'm so proud of you for getting through this journey, man. I can't wait to come to Houston and celebrate with you. But yeah, I know it's a blessing, and as time goes on, man, you just don't look back at what you went through and see that you can do anything you put your mind to. You know what I'm saying? So congratulations once again.
Thank you
That's
guys. Couldn't have done without you guys. I appreciate everybody here who, just giving information, just being an ear, and just couldn't done without the support of you guys. So thank you guys all very much for everything.
We have a caller on the line. Who just joined?
Hi, it's Pam Barr. I couldn't get my sound to work through the app.
Oh, yes. Awesome. We can hear you now. Thanks, Pam, for dialing in. Is there anything on your mind you had questions on or wanted to discuss?
Nothing right offhand. This is, I think, my first support group since my diagnosis, so I'm just here to listen.
Okay. Well, let me know if any questions come up. We'll come back to you.
Perfect, thank you.
Okay. Alexa, is there anything on your mind that you want to discuss or any questions?
I'm waiting for there we go. The only thing I have to say is that if you saw the deer picture with Brian, the deer did come back while he was wearing another RMC shirt. That is not a coincidence. That deer is very committed to the RMC cancer community. That's all I have to share tonight. But I'm so glad for you, Brian, and I can't wait to hear from everyone else the same stories too.
That was a precious picture. I posted it on Facebook.
I know. I saw that, and I'm just like, and so the fact that the deer came back. So I don't know if anyone saw it, but there's a wild deer who went up to Brian. He's wearing one of his the most recent walk shirt that we had, and he's able to pet him and everything. And we hadn't seen any of the deer or anything. And then he was wearing the previous year's walk shirt, and the deer was back. So coincidence? I think not.
No.
Thanks, Carissa.
Yeah. David, can you hear
Yes,
us?
can you hear me now?
Yeah, we
Yeah.
can hear you.
Yeah.
Yay.
Yeah, I'm using a different computer now. My Mac's microphone for some reason would not work. I have no idea why. Either the internal microphone, well, neither that nor the earphones that has a built-in microphone, neither of them work. So I don't know why. But I'm using a different computer and it's working now. So. I
Is there
I
any
couldn't do your app idea because there's no space on my phone. So.
Oh, it's okay. Is there any questions you have or anything on your mind or anything you want to share?
Well, I have a plethora of questions, but I don't. Maybe now is not the right time to ask. I think
Oh,
I
no, this
suppose
is
the most
very
basic one, the most basic
Mhm.
one is what is this? I mean, is everyone here that I can see on the screen sufferers of RMC or being diagnosed with RMC? No.
So some of us are patients, some of us are caregivers, some of us are caregiving at the moment, some of us lost people. So we would say Brian, he just he just gave his news, so he's in remission, and then Andre as well. Um, uh, I lost my husband to the cancer, and I met Alexa, and she's been like a great advocate with that. Nicola lost her husband. She's in the like she's oh well, you met her. Uh, Richie lost her son, and she started the foundation and helped started the support group. Milton has lost his son. Lois has lost her daughter to RMC, and Aisha's son is battling RMC right now. So I
I
have a
see.
whole
And
a whole slew.
Pam was just diagnosed.
Sorry, Pam. Thank you. So,
Okay, well, thank you
what
for
else?
explaining that.
Yeah, and what other questions? Because we're here. This is where you ask the questions. Um, we definitely have like a different slews of things, so we definitely can help you out and definitely connect to here. So feel free to answer any questions,
I
ask any
don't know
questions.
whether,
Well,
yeah, I don't know whether David, you want to tell a little bit of your story.
okay. Um, I'll try and make it as concise as possible. So, yeah, it was Good Friday, so it was April the 2nd in 2021, and I was abroad in the Canary Islands, which is some islands that belong to Spain. And I just went to the toilet one morning, the morning of Good Friday that year, 2021, and felt generally okay. And I just urinated blood for about 10 to 15 seconds. It was very strange. I didn't know what to do. So I just went to an urgent medical center, and they didn't speak English very well because obviously Spanish is their main language, and they thought it was an infection. Gave me some antibiotics or prescribed me some antibiotics, and then I went back because it happened again, and then they reckon it was kidney stones. So I called my doctor in Scotland. I'm from England, but I live in Scotland now, and she said if I were in the UK, I'd have a scan. So I went back to the medical people on the Spanish island, and they said you're not going to have a scan because there's nothing wrong with you, basically. So I paid for a private one in a private hospital, and they found a hyperdense mass in my right kidney. Then I flew back to London, and then quarantined because it was COVID, and then I had all sorts of procedures done to me until eventually they did a biopsy and thought it was another cancer called collecting duct carcinoma, and then it was a day before my 39th birthday, and then what happened? Then they wanted to remove my kidney, so they removed my right kidney 8 days later, and then confirmed it was RMC, and then obviously that was devastating news, and then I had chemotherapy, which finished January last year, and so far the scans have been okay; they've been clear, which is great news.
Glad to hear that.
Thanks.
Clear.
um, I do you mind if I tell mine? I think everyone's is very different and how it's Pam on the phone.
Hi, Pam.
Hi. So I was I had I was diagnosed with rheumatoid arthritis last November, and they started me on sulfasalazine for treatment, and I went into DRESS syndrome. And they couldn't figure out why I had this rash and fever, and on it they did this pan scan, and I had the right renal mass about 2 centimeters. They followed up with an MRI. It looked like renal cell carcinoma. So my liver enzymes were through the roof. They had to wait about a month before doing a partial nephrectomy. And it was actually, everything happened pretty quick. So in February of this year, I had that, and then biopsies came back as RMC. And then I went down to Houston, to MD Anderson, for recommendations, because I live in Montana, Billings, Montana. And so I had so far 2 rounds of chemo, tumor markers down, but my white count's down also. So I'm not sure if they'll have to delay treatment, but I never had the signs. It was really an incidental finding, but still devastating. I'm not sure if everyone had a different presentation when they were diagnosed.
Yeah, my husband had urine in the blood, and he had like shortness of breath. That was pretty bad. But like the cancer spread to his lungs. I know like other people like had like pain, like different pains like back pain or different like really bad pain. Anybody else want to share the symptoms they've experienced?
Yeah,
Basically,
I think,
oh,
go
go
on.
ahead.
Yeah, Mickey started with pain in his testicle, and in his right side, and then stomach pain, night sweats, fevers, weight loss quite quickly, and generally feeling unwell quite quickly. That's how he first started.
And Chris started with severe back pain, and then it wasn't until he had blood in his urine that they did the CT scan to find the 7 centimeter tumor in his right kidney.
My story, I started showing signs and symptoms, right pain on my side, where my kidney was located, and blood in the urine. Um, so I went to the hospital, though. They said, hey, it might be kidney stones or some other type of infection or whatever. So um, they gave me something for that. And then I presented with the same symptoms again. And that's when I had a CT scan, and when I was diagnosed, when they diagnosed me with RMC. Um, they diagnosed me with RMC in April 2019. So I'm 4 years in. Um, so I just wanted to share that. I got my first clear scan in October 2020. So about a year and a half or so, I had to go through the chemo and radiation and immunotherapy. Um, and my scan's been clear ever since. So um, this is a battle that can be won. I know the prognosis may show a not so great outlook, but I mean, I'm a testimony that this thing can be beat. Brian shared earlier, his clear scan results. So um, yeah, this is what this group is all about. Sharing and leaning on each other, and um, I'm so happy that David and Pam can join the group tonight. So feel free to share, any questions you may have. Um, I've been through this journey. I did probably every chemotherapy they have, immunotherapy and radiation as well. So, um, yeah, feel free
Andre,
to
where were
share.
you seen? Which doctor, which hospital, whereabouts did you have the treatment?
Okay, yeah. When I was first diagnosed, I was diagnosed at Walter Reed in Maryland. But I got my kidney removed from Walter Reed, and then I began my chemo sessions I chose to go to MD Anderson in Houston. Under
Okay.
my oncologist was Dr. Masai.
Yeah, I've emailed
That's
him.
that's who my oncologist. Well, he's following me. I get treatment in Billings, but Dr. Masal is who I saw in March.
Okay.
It's
Let's see
interesting about
here.
the immunotherapy because over here in the UK, I was told that immunotherapy wasn't an authorized treatment option. So I'm curious about that.
I haven't
Um,
like Sorry, you go, Andre.
oh, I was just about to say, so I started out with doxorubicin and gemcitabine. So that's what I started out on as far as my chemotherapy treatment. And then Dr. Masai switched me to, because you can only get so many treatments of the doxorubicin. So he switched me over to immunotherapy. So it was Opdivo and Yervoy were the two immunotherapy drugs that I was on. It worked for a little while, but the cancer became resistant again. So I went back on a different chemotherapy route. So I did cisplatin for a while, um, and then I did carboplatin and paclitaxel. So that was the last chemotherapy that I had. I did that in conjunction with radiation. So every 3 weeks I would do the carboplatin and paclitaxel, but every day for 28 days, so 5 days a week. So I did that for 28. I did radiation for 28 days, and it's a targeted radiation, and they wanted to target my lymph nodes that were near my right kidney where the cancer had spread. So
So you got, after your first batch of chemo, you had a scan and the cancer hadn't gone, or it returned later?
so um, I did I did 3 treatments of the chemo first, and then I did a scan. So I think like after every three chemo sessions, I would do a scan. So after the third one, it showed that the cancer was shrinking. It was shrinking. It was shrinking. So I stayed on the chemo, and then after 3 more treatments, I got another scan, and then the cancer showed that it became resistant to the chemotherapy. So that's when Dr. Masal had to switch me to something else. And he's great at being proactive, with the treatment. So um, once the chemotherapy is showing, once the cancer is showing signs of being resistant to that chemo, that's when he switched me over to immunotherapy. Same thing with immunotherapy, then he switched me over to something else. But I kept showing signs. The cancer kept shrinking through the chemo, and then that's when they went in with the targeted radiation to target, those specific cancer cells near my kidney.
Sure. Thank you for sharing that.
Aisha, do you have any questions or anything on your mind that you want to discuss?
Yes, I was having technical difficulties, so I'm sorry. I didn't hear the good news, Brian. I mean, I know of the good news, but I didn't get to hear you say it. So I missed that. I'm gonna have to look at the recording. But I was trying to get on so I could hear it. I do have an update for Gregory. Hi David, hi Pam. My son Gregory was diagnosed with RMC. uh, well, he had blood in his urine in September 23rd of 2022, and they told him that he went to the hospital. They told him that he had possibly kidney stones, but then they did an ultrasound, then they did MRI, and I think it was an MRI. No, it was a CT scan. CT with contrast. The CT and the CT with contrast. And then they said that it was like some type of kidney cancer, but they didn't say specifically what it was. He wound up having a biopsy, and we got the actual diagnosis about October 2nd or 3rd. And then we started in MSK, and he was getting carboplatin and paclitaxel, and it was working initially. Um, it, and then it I guess became resistant because it stopped working. It started spreading. He's in stage 4. It spread to it started in his kidney, liver, lymph nodes, and his lungs. So he decided to come to MD Anderson. So we've been at MD Anderson with Dr. Chenier. That's who we reached out with when we first heard of RMC, because we didn't know what it was. And he was very informative, and we came down here for Dr. Chenier, and we've been getting treatment since. Um, they changed his treatment to what Andre had said. Uh, the two initial drugs. I know it's a red drug and another drug. I'm not too familiar with the actual wording of it, but he did the same two drugs. of chemo drugs, those drugs were pretty rough on the body. So I definitely can understand why you're only able to get a certain amount of treatments of that. He did about 5 treatments of that, and then they just switched him back to an immunotherapy drug as well as carboplatin and paclitaxel, but this time it's protein based. And that has been working well based upon the symptoms that he's been having. It's been up and down. We've been in the hospital a lot. Most recently, he was having problems with his breathing. He's had a few bouts with pneumonia. He's had scoped of his lungs various times. His white blood cells, as well as his platelets, have dropped tremendously with the chemo. Um, but with this new chemo that he's on, he he's not as symptomatic as he has been. He would have this terrible cough. He wouldn't be able to talk. He would have very low energy, to the point where he had to use a walker. He had to use a oxygen tank. He had to have breathing treatments. He had to have a wheelchair. So recently, he's not using all of those devices. He's able to talk, he's able to breathe, he's less on the oxygen, whereas before his oxygen would just drop down. So the new treatment, and he's had it for 2 cycles. He'll have his third cycle because he gets it every week um, this Thursday. But between the first two, it's been great. Um, so he and I both are just very happy that things have been calm and he's somewhat back to normal and he has more energy. And it's just been calm because it's been pretty rough. Um, but we have a lot of hope with Andre and Brian, and definitely happy to hear the good news and the progress of everyone else. And we know that it's ups and downs, and you got to take the good when it's good, and we take the challenges when they come as well. But God is in the midst of everything, and that's where we we keep it. We're thankful to God for all of our blessings. So
Yeah, Aisha, thank you for sharing. And yeah, I'm glad, inspired by like how positive like Gregory is and his attitude like throughout this. And here
yeah.
I'm inspired.
He's here. He hears y'all, but he's listening today. He's not going to be on camera today. He's just listening.
Sounds good. Sounds good. Milton, is there anything you wanted to talk about? Share or had any questions?
No,
You're on mute.
I suppose there's no questions that come to mind.
Okay. Lois, anything you wanted to share or had on your mind? You're on mute if you're trying to talk.
Yeah. Okay. Do you hear me?
Can hear you, yes.
Yeah. Okay. Um, just some comments on immune therapy. For us, it was not very successful. Uh, Probably the suggestion for immune therapy came towards the end, when everything else was not did not seem to work quite well. I think the last part was of immunotherapy was devoid, if I remember well. But the thing is, the cancer had already spread a lot, so a kind of side effect of immune therapy, as Dr. Mzawel said, was to cause collapse of the kidney, of the other kidney, the function of the kidney. So that's why we ended up being on dialysis. So my daughter was on dialysis towards the end. And he suspected, Dr. Mzawel suspected that that was caused, this stress of the other kidney, because there was no sign of cancer on the left kidney. The right one was removed in 2021. So spring 9th of April 2022, function of the other kidney stopped. So she stopped urinating, and she went on dialysis. And Dr. Msaul said that he's seen this happen to other patients as well. But in some of them, the function of the kidney came back. But unfortunately, this didn't happen to Fenina, to my daughter. And that was the same as Caleb. If you know Caleb's case, and because we've been talking with his mother, and he had the same thing at the end. Stop the other kidney, the only kidney that was left, stopped functioning towards the end. And this might be caused by immune therapy. So every case is unique and different, and not everything suits every case. So in some people, as I hear there,
Lois, you're on mute right now.
so I was saying that not everything suits everybody, and some of the cases that I hear now, in some people, immune therapy has done wonders, but yeah, in other cases, depending on the stage and the spread of the disease, I think the more I think of it, the more I'm sure that the more the disease is spread, the more difficult it is to have a positive outcome, let's say. Because when Fenina started, the disease was already really spread in 5, 6 different parts of her body, and that made things more difficult to treat. But again, you can't say that this is the case with everyone. That's a strange disease, and it's unique to everyone. So yeah, if you need to ask anything else, you can ask me. I just wanted to say this about immune therapy.
Thank you. So
Thank
I have a
you.
quick question. Was the cancer found in the right kidney
Yes,
originally?
in my daughter,
And how
yeah, it
big
was found.
was the
Pardon?
tumor? How big was the tumor?
The tumor was about the original tumor, as they said, uh, 2 or 3 centimeters. Yeah.
Okay.
But again, I think from all the cases that I've seen, and I've just observed that these years, the size is not a problem, because there are some tumors that are quite big but have a very positive outcome, and some others start being very small, but then they have a different dynamic. So again, you can't say that the size of the tumor is critical. I don't know. I'm not a doctor, so I can't say that. But just that's my idea, the way that I've seen in other patients these years. For example, Nico, Daniel is not here today, and Diana from um, forgot forgot the country. Where is Daniel from? And Nico, Colombia. uh, he had a bigger tumor, and it's all very well now. I mean, in Nico. Nico is fine now, this boy. So I can't actually tell. Dr. Mzawel might know more about that, if the size plays a role in the whole thing.
Okay. Well, thank
Yeah,
you, Lois, for sharing.
yeah, thank you.
So there's like a couple things I wanted to talk about. So I know like when I came for the walk, me and Alexa were kind of brainstorming, and basically it looks like the NFL and the colleges don't want to spread RMC awareness themselves. So had the idea of us doing scholarships. Um, so wanted to like see if anybody would be interested in brainstorming. I think like for me, like July and August work slows down, so that would be like a good time like to talk about that. Um, but if anybody has like any ideas, basically I want to like raise funds for it. I already started raising funds from I had a karaoke night on Carlos's death anniversary, so raise some funds there. But want to raise some more funds on that and kind of define the terms of like what we want to do with the scholarship, who we want to target, what they're required to do. So definitely would like to start a committee if anybody would be interested um, on that. Anybody on the call would be interested in being involved in that, like brainstorming.
Well, I'd be more than happy to do whatever you want, but I don't know much about US stuff. But whatever, if I could be of any help, I'm happy to be of any help.
Thanks, David. Do you mind messaging me your email address so I could?
Sure, here, yeah.
Yep, in the
How do I
chat.
do that? Sorry, I don't know how to use this go-to thing. Where is it? Why am I?
On the
It should be on your right hand side. Depending on what you're on, you may see two little. We've done some
Oh
messages
yeah,
in the
got it.
chat, so you should see.
Sorry.
Yeah.
Yeah, sorry. Yeah, my email. Fine, it's coming. Well, I'll just put it publicly. I don't mind. You just mentioned the NFL and colleges. So by colleges, I guess you mean universities. You're telling me that United States universities and the NFL are not interested in doing anything to help awareness spreading of RMC.
You are exactly correct, David. So, the NFL, just to catch you up, the NFL recently had a couple of patients with RMC died. One of the most famous ones was Ronnie Hillman.
Yeah.
Richie and I went to work on that. We got zero response from anybody. And Ann Ken, we actually contacted somebody we were trying to look at, and they're called historically black colleges here in the United States. We were trying to make connections there because all we wanted was just for people to be aware if you do have the sickle cell trait, to be aware of your risk, maybe get counseling because we know dehydration is a link to RMC with the sickle cell trait. Hey, maybe high intensity sports is not a good idea for you, but if you do want to continue, what if we give you an IV afterwards? Just very basic level stuff. We've been basically getting nothing but pushback, and Chris and I were talking about that in April, and we've just been trying to figure out what do we do because the NFL does not seem interested. The historically black colleges and universities not interested, and even just on an academic level, period, it's been very difficult. My mom has even noted, like, if you talk about RMC, it's like talking about something that's cursed. Like nobody wants to talk about it. And as we all know, the only way you can make any change and help people and save lives is if you do talk about it. So that's definitely something awareness, as Richie knows, who's been doing this for so many years. It has been a slow moving process, unfortunately.
Do you know what the main reason is why people have been, well, reluctant is probably an understatement, why people are being reticent or why people are being Well, basically, we don't know. It's just a simple no. If they
Sure.
give me a reason.
So part of the thing with the NFL is because the NFL has had a lot of bad publicity with traumatic brain injuries, the head injuries, and issues that have happened. I don't know if you've heard very much about in the UK. There have been several people who have had like mental breakdowns. They haven't acted like themselves. They've just had a lot of issues from head trauma, repeated head trauma. The NFL does try to avoid any medical issues with their players for that reason. So that's part of why they don't want to touch the RMC issue. Colleges, in my opinion, universities, colleges don't want to touch the RMC issue because of kind of getting signed. So it's good for university because a lot of these people are athletes. It's good for university if the NFL, the soccer, football, anything like that, if they sign one of their players. It's good for them. So I think they don't want to do anything that could potentially get them signed from going to a major league sport, unfortunately. So if the what I think it all boils down to is it's greed and it's a negligence of human life, of understanding human life is more important than profiting or making money.
Well, that's truly shocking.
Yep.
And that's the problem we have, David, in the UK, isn't it? Trying to get the message out and people interested. So we've
Mm-hmm.
got more awareness going on, and it feels like it's just me in the UK, just
Mm-hmm.
trying to, raise this awareness and making contacts with people in the medical profession, which hopefully, I was saying to Richie before, I've had a couple of meetings with like the head of scheduled care, the primary care team, that's going to put me in touch with like Cancer Alliance, so we can raise awareness across Greater Manchester and it can go further. So hopefully, it's all about everybody getting equal, the equal opportunities to know everything. And that's what I'm obviously doing, and they obviously know how passionate I am, and now I am constantly knocking on doors, so I'm not going away. So hopefully in the UK, and with people like David, David can work with me as well. He said he'll help me, but it's sometimes it's knowing where to go into and where to start, and you just got to keep breaking down these walls.
Yes, agree. And then I wanted to kind of talk about
Wait a
something.
minute. Before we go any further, since 2010, the NCAA has been screening all Division One and Division Two athletes for SCT. So SCT screening or RMC cannot happen without SCT. So you're saying something that is partially incorrect, as if they don't have knowledge of it, because that's been going on since 2010 for Division One, all Division One and Division Two athletes. I just want to point that out.
Are you referring to
So
what I was saying, Milton?
uh, anyone who's saying that, but it's not as if they might. It doesn't take away from your point, but they have been screening. And the
Right, we're
NCAA,
requesting counseling of the information that yes, you have that data, but the reality is Richie knows because Richie was one of the very first people to say that dehydration was a direct link, and they were telling her, no, it's not. We want them to be responsible with their patients that do, well, they're athletes, but they are patients with sickle cell trait and making sure they're having breaks, extra hydration, that sort of thing. It goes beyond knowing is half the battle, but we have to do stuff with that knowledge to prevent RMC.
so we're replicating what the Aswan Foundation is trying to do.
I don't fully know what they're trying to do.
Well, do you know what the Aslan Foundation
Yes, I
is?
do.
Okay, so I'm just saying that, so carry on. But I'm just pointing out, what I do know.
Yeah, the Ask One Foundation has been instrumental in trying to get the education piece out there. Their focus started off with the high school coaches. I'm not too sure how far they've gotten with the college coaches, but I do know they've been doing some community outreach in many of the black colleges. So it's still work in progress. I think the biggest issue um, with education, with sickle cell trait education, as far as college is concerned, is I guess, the stigma that's attached. I think, and even in high school, I think these kids, if they're labeled as having sickle cell trait, they will feel that the coaches will not allow them to perform to their capacity, or not to let them play for fear that something would happen to them. So I think that's where some of the problem is, and that's what we need to do, is get them truly educated to understand that these kids can still play, but they really can't do vigorous high intensity exercise without hydration. They really can't do high intensity exercises at all if they have sickle cell trait, but they can do it within moderation and be hydrated. So that's the piece that's really missing, and it's going to take a lot, to get out to the several colleges. And I think I'm even working with this Boston University, the public health department. It's just so many people are working on different pieces of this puzzle till it can be confusing. They're working on, I guess, the language to use to try to get the education piece out there.
This is
So it,
sorry, I didn't mean to cut you off. This is Pam from Billings. So I work in healthcare, and after my diagnosis, every physician that works with me said they've never heard of RMC, even in medical school. And so it's, yes, I'm sure that these professional organizations are trying to avoid this conversation, but it's hard to even start the conversation when the majority of the medical community doesn't even know what it is. And I was surprised. I mean, I was surprised to hear how many physicians didn't know or hadn't heard of RMC until I was diagnosed and I worked with them. And I
and
think
Pam,
that's a big deal.
right, and Pam, you are correct, and that's been the dilemma for
Normal,
a
yeah.
I'm a registered nurse as well, and they give even the medical students, what, 5 minutes on sickle cell disease. So sickle cell trait really doesn't get any traction because the myth is out there that this blood disorder is benign.
It's harmless,
So
right?
yes, yes. So we definitely need to hit the medical schools, because we know it's many, many, many physicians out there that don't know, and that's why everybody on this call that is talking about their diagnosis, they were misdiagnosed initially. So that lets you know in itself, worldwide, that there is an education piece missing. And that's what
Yeah.
we have to figure out. How can we come together? And it may be one medical school at a time, but how can we come together to get this information out?
The thing, Richie, as well, the sickle cell society over in the UK, which is quite big, they are not even interested in listening to me.
You're
Um,
exactly right.
no,
100%.
yeah, they're
Same
not
here.
interested. Yeah, not interested. You go on the NHS websites and it's all about the sickle cell trait. There's no mention of signs and symptoms of RMC or things to look at. There's just nothing. Um, it's yeah, it's shocking.
It's the same thing here, and we are making just small baby steps in the sickle cell disease community.
Yeah.
As one has been instrumental in getting through with the Sickle Cell Consortium, but each year we have seminars or conferences, 5 day long conferences, and all we get is maybe 30 to 45 minutes a day to talk about sickle cell trait. And it really should be a general session. That's what I've been pushing for years because I still go back to the same analogy. Sickle cell trait is the nucleus of all of these problems. So
Yeah.
Yeah,
until people realize that, we're not going to get anywhere.
yeah. We had a nurse who looked after Rick, and she was not so long ago was trained by to become the sickle cell specialist on the ward. And the trainer said, "Have you got any questions?" And she said, "Yes, what about RMC, which is a rare form of renal cancer?" And she just said, "Oh, we don't need to touch on that because it's something you will never come across." And I was just horrified at, somebody medical training people with sickle cell to be, advocates, and to that was just ignored and brushed off. And yeah, that's what you're dealing with.
Anna, welcome. See you on the call. Any questions you had or anything you wanted to talk about?
No, I'm all right, thank you. I just had chemo yesterday, so I'm a little tired.
I'm glad you're here.
Thank you.
Okay, the other thing I wanted to talk about, so I was talking to some of Carlos's fellow judo people, and um somebody who used to actually drive us to the airports all the time when we went to Texas. He's having a judo tournament September 10th. So Andre has agreed to come with me. And we're gonna have like a little booth section, just to talk about RMC and raise awareness. We're gonna have like a table for Carlos. Thinking about having some goodies like where we could raffle, and I'm gonna talk sometime in July to him about things that we just want to make sure that we're covered. And he told me there's plenty of judo tournaments. So if like this one's a success, or I could see if like we could talk at other judo tournaments just to kind of bring awareness on there. And I would just tell you guys, these are people. A lot of these people are going into Olympics. Judo is like Olympic thing, so this might be like a way in to talk. And Carlos was Olympic caliber, but he decided he didn't really want to pursue that. He wanted to get an education, so he didn't go the Olympic route. But a lot of these people are in that, like a lot of these people are in that caliber. And um, if anybody's like heard of Ronda Rousey, um, she was in a couple. I think she was in the Fast and Furious, and she's done wrestling. Carlos actually like knew her. And if anybody's watching Judo Olympics, like Kayla Harris and Travis, are people that were friends of Carlos. And Kayla actually came in. Um, she actually came to beefsteak for Carlos, and actually I think gave something for the fundraiser that they had for him. So I thought this would be like a great in to at least get it into the judo community, because Carlos was very well known in the judo community and very likable person. So gonna have that. I'm excited to have Andre, so they could. I feel like this would be a place for people like to hear, to talk, and to be of interest. Um, Anybody have like any questions or suggestions that might be good, like to ask, or like during this tournament, or to have?
Is there any screening that they do, like they do with the sports when it comes to judo or anything like that, or it's just there's no screening or anything?
I don't think they have I don't think they have any screening, but I know like Milton had talked about having something like where coaches have like filled have like screening included in the form so that they're aware of that. So that's something that could
Yeah, they
definitely.
put that on like the health forms when it comes to like the public schools and stuff. I know in New York, but I didn't know if they do any of that when it comes to like any type of martial arts. If they do that, like if they have to fill out a health form or anything like that. So I guess
Yeah.
that would be a question, like to find out the process. I'm sure, like
Okay.
competition basis, they probably have something. I'm sure they probably have at least a waiver, a medical waiver, so that they're not, sued for anything. But I just wonder if there's any type of paperwork that they have to fill out if they're competing that has to go through any type of medical records, or if there is, a box that asks about sickle cell or sickle cell trait, or any type of blood disease or anything, or.
Okay. Yeah, that's definitely.
So that's something to ask or
Okay.
to be aware of. I did have a question for David and I guess Pam, because I came in late. I just wanted to know, are you still receiving treatments? Like what's your current status, or are you both in remission?
My oncologist told me that they don't like using the word remission, but I think I am, in the sense that, so I had the mass in my kidney, and then the kidney was removed, and then every scan I've had before and after chemo hasn't shown any sign of metastatic disease. Although I have had symptoms which panicked me, like pains and breathing problems. I don't know why, but whatever, they're happening. But so I guess so, yeah. So it's just regular
Uh,
meetings and scans for me now.
When you were diagnosed, was it like a stage one? Did it not spread?
So when they thought it was collecting duct carcinoma, which I read online was quite a common misdiagnosis, it was stage one of that. And then they said they wanted to perform the radical nephrectomy to remove my right kidney, which they did 8 days later. And it wasn't until they analyzed the kidney, the local lymph nodes, and something else they moved from my body during that surgery that they confirmed it was renal medullary carcinoma. And the urologist consultant, this is before I was with oncology, who removed my kidney, he broke the news to me face to face, and he said it. He's one of the most experienced people in the hospital, and he'd never even heard of RMC in his entire life, either professionally or academically, um, until he looked it up online. And so, what was your question again?
I mean, I think you answered it, but I wanted to know if you were at stage one or if it had
Oh
spread.
yeah, sorry. Just forgive me. It's 2:04 in the morning here.
Oh
It's five
wow.
past two in the morning. So yeah, it was stage one, collecting duct carcinoma, and their recommendation was remove the kidney, get on with your life. Then when they analysed the kidney under the microscope and found out it was RMC, they upgraded it to stage three metastatic cancer because it had spread to the other things which they'd removed in the surgery. So they'd known it had left the kidney.
David, which hospital is treating you?
Royal Berkshire Hospital in Reading.
Okay,
Mm.
okay, okay. And have you had any contact with any of the London teaching hospitals or
Yeah, I had contact with Professor Thomas Powles at St
okay,
Bartholomew's Hospital in London,
at St Bart's? Okay.
and he's
Um,
basically got me on a backup kind of whenever I have a meeting with my Reading team, I will have a
right.
telephone appointment with him just so he can give me his opinion, or someone in his team gives me their opinion.
Is there stuff, Nicola? Is there stuff going on at the Marsden or not?
Sorry. Nothing that I know about. No one's. It's just so difficult, Rick. No one's really interested. To be honest, it's you
And
know,
that's
try.
what she was talking about earlier too. She's been trying so hard.
Yeah.
Yeah, yeah,
Yeah. Well, I
trying to
mean,
get,
I know we talked about it. We talked about it once before,
just
and
trying to get a foot in the door with some clinicians over here to just raise that awareness.
have
Um,
have we have we talked, Richie? Have we talked to Dr. Masoul or Dr. I always his boss, the old, who's the
Dr.
other guy?
Tanier.
Tanier. Thank you. Have we talked to Dr. Masoul and Dr. Tanier about if they're working with anybody in the UK?
They
so
are working with the physicians in the UK.
And who are they
yeah,
working
so
with? Go ahead, Nicola.
well, I think you mean, are they working with our doctors at the Christie? Maybe
Okay.
Richie. Um, so I think with Leon's doctor, they're just communicating. I don't know again how much they are doing, but I know they're having contact. You know, Leon's wife says one thing, and so it's difficult to know what's really
Right.
going on.
I don't know. I mean, it's the one thing I'm thinking of. It's not. I know it's not her field, but she knows all. She knows a lot of the British doctors. We could ask. We could reach out to
Don't
Dr.
choke.
E.
Don't choke.
Sorry, Pam. Okay. Um, we could reach out to Dr. E, Alexa, and see if we can get any contact.
Yeah, Dr.
And
E might, I didn't think of that. She might know some really good physicians in the UK,
well, she's going to know the
urologists.
G. I mean, she's going to know
Right.
the G. I mean, the people that we have access to. We have some access to some great physicians like Dr. DeBono at the Marsden, and the and isn't it, what's it called now, the National Cancer Institute? I've been away too long, I can't remember what's the name of the cancer hospital, the not the Marsden, but isn't there a cancer institute or something?
The Christie, but
No, I'm thinking on a national level, not the Christie, but there
oh,
is a the well, it doesn't matter. But I mean, I
yeah,
know the Marsden is the
yeah,
main.
yeah. I've not been in touch with any of those doctors. I mean, I would have thought that
Yeah,
that Dr. Tom Waddle, who's renal, who's on my board at the Christie,
yeah.
would be, but I just think again difficult.
Why don't you ask Waddle if there's anybody at the Marsden, and let
Yeah,
me
I have.
see. Ask Waddle if there's anybody at the Marsden, because he would know, and we'll check with Alexa, with Elaney. Um, I'm gonna be in
Yeah.
an advisory board with her for about 3 hours tomorrow. So when there's a break, I'll send her a chat message and I'll see.
Okay, good.
But we've just got to try and pull in. I mean, David, is the guy that you're seeing at the Royal Berkshire? Is he a genitourinary medical oncologist? Does he specialize
It
in
is a she, but no. Well, she's not. She's so I had a second opinion because the first thing I did when I was diagnosed with RMC is I spent a lot of time on the internet reading as much as I could, and then when I
Yeah,
heard with the horrible stuff that's online about it doesn't chemotherapy doesn't typically work with it, I
yeah,
they wanted me to start chemotherapy immediately, and I was like, well, I want a second opinion. So they put me in touch with someone at University of Oxford Hospital first called Professor Provorot, who just basically gave me two sides of a coin argument of doing nothing, as in don't do chemotherapy, or doing chemotherapy. And then for a charity called Kidney Cancer UK, I think,
yeah,
I was told to refer myself via my GP to Professor Thomas Powell's at St Bartholomew's Hospital in London, and then I
yeah.
went to see him face to face. Um, and when you look him up, he's supposed to be world leading kidney cancer specialist, not necessarily RMC, of course. So there was another guy in Glasgow where I am at the moment. I haven't met him, but I've told that he's really interested. But that's about it. But the Marston I know is the most, I would say, renowned cancer hospital in the United Kingdom, but I've had no contact with them at all whatsoever.
See, I
So the
would
guy
think,
that's interested, David, what's he called?
The Glaswegian professor, I don't know.
Yeah.
I can find out,
Oh,
get back to you.
yeah, because we
yeah,
could do
Oh, because
with
your doctor, who I met at your charity event,
yeah,
he actually knew this guy and told me to meet him as well. I forgot he told me that at your event, so he knows his name. That's for certain.
right. I mean, uh, yeah, I don't want to say too much, but it's difficult. Like we us as a trust and my doctor trying to develop some sort of module for Cancer Gateway C. I don't know whether you've heard of that, Rick. And it's
no,
basically a module for GPs for early diagnosis, which we'll be doing. We're sort of involved in it, and at the end of it, it's going to be a little bit on RMC. But again, they don't have to do the module, they don't have to read it, they don't, there's only a tiny little bit on RMC. It's, it's something, but we're on 6 months delay of that already. So we are trying to get in to educate these people, but because of RMC being, to me, it's just silent. It's not rare, it's silent and getting misdiagnosed. They're not interested in the bigger picture, and we can't get these clinicians to invest all the time. And, we need people like Dr. Masoul and, that can see the bigger
And
picture.
sorry, and I think if I may say something on that, there are some physicians and clinicians that are reluctant in communicating with Dr. Msawel, and they expect him to contact them. And I remember from our case when Dr. Msawel told me that it's impossible to start to remember and contact every physician around the world. So this is very important for every patient and his physician to persuade him or her to have constant contact with Dr. Mzawel, because unfortunately there is not a center in Europe that is specialized on RMC.
right.
There are no doctors actually who are specialized in RMC. And unfortunately, everybody should be dependent on Dr. Mzawel's opinion. And many physicians delay on that. And another thing is that many institutions do not organize scans on a regular basis, and it takes time. But RMC has no time. It's very aggressive, and things should be done very quickly. And the doctors, at least in Europe, do not realize that. Uh, and we have to actually run behind doctors and chase them
Mm.
to do what they are supposed to do, because they it takes time for them to realize how fast RMC is moving. And it happened to us, and it took some time um, to just get the physicians have a regular basis, and everything went on smoothly after the first maybe 3 or 4 months, because they realized that it was very fast. Uh, so I think it's very critical for the physicians to contact Dr. Mzawel and remind him that they are there and they need their guidance. And some physicians do not, I don't know if it is a matter of superiority or I don't know. I really don't know.
I think,
And they don't communicate on a very regular basis.
yeah, I think the problem is as well in different parts of the world, we can't have, you know, our doctors will say we can't have the same, we can't treat the same here, and their hands are tied, and so they almost sort of then say there's no point
Uh,
in, you know,
Yeah, but
yeah.
there is a point
There is
because
a point, right,
yeah,
Lois? Right,
yeah,
there
yeah.
is a point, and this is
So
where,
this is
there is.
my
and you
thing.
got to
Yeah,
say,
Yeah,
if you don't know what you're doing, talk to somebody who does. Maybe you can't get that
yeah,
drug, maybe you
yeah,
can. But you know,
yeah,
when they say that to you, because we hear the same thing, and it drives me nuts. I get
yeah,
so pissed off when I hear that. And David, I mean, what I would say, man, is get your doc in touch with Dr. Masoul as soon as you can. Your doc at the Royal Berkshire, and
Yeah,
you know,
I did. I have that. Well, apparently that has happened right at the
good,
beginning, but it took a lot of effort.
it
They
took
were
a lot.
reluctant and they didn't want to.
Yeah,
And I felt, although I have no confirmation of this, I felt
yeah,
there was almost a kind of NHS, you know, socialized healthcare versus
right,
predominantly private healthcare in the United States of America, kind of arrogance on both sides, going, "Well, I'm not going
right,
to ask them for help." Well, it's like,
right. No, I mean, I get it. I mean, I was raised in the UK. I've lived here for many years. I understand both sides. I mean, I've got another really long shot that I will try, but the current president of the Royal Society of Medicine is a retired urologist, Roger Kirby, and he's a really good buddy of my best friend. They were at Cambridge together, and I mean, going back 50 years. And I will see if I can. I got to talk to Mark tomorrow or the next day. I will see if I can lean on him to speak to Rip Kirby and see if we can at least come up with a lead at the Marsden. I mean, there's
yeah,
got to be somebody at the Marsden who's
that'll be
doing
great.
some
Yeah.
work or has some
yeah,
interest.
yeah. I put him in touch with us to work with us as well, Rick, and you know, just to help. You know, if we have somebody else on board in the UK, that'd be amazing.
Well, I'll let me see what I can get Mark to. I'll talk to Mark and I'll see if I can what other ideas he has. I mean, you know, he's a retired. His area was different. He was in breast and melanoma, mostly breast, so his area is different. But I'll lean on him. He's on our advice. Mark, not Rip Kirby, but Mark Kissing is on our advisory board, and we'll see. But you know, it's just. I mean, I feel for you, David, and Lois feels for you. We know. I mean, we and certainly Nicola, but you know, you stay close to us and we'll pull whatever strings we can. I mean,
Oh,
there isn't
thank
a
you.
lot. And listen, we know that it works sometimes, chemo works. Look, I mean, we just had a guy who came through and look at Andre. Look at the
Yeah, Andre
captain.
was
I mean,
saying.
Yeah, yeah,
Captain,
yeah.
Captain Andre did bloody great. And
Yeah.
so
Mm.
we know it can work for
It's like I'm, you know, Leon, another patient now is you know, he's struggling at the minute, and now I'm in a panic now. What's, you know, for him, like, what can we do? And are the doctors gonna just sort of think, well, there's nothing else we can do, you know? So
I know.
that's my worry now for Leon in the
uh,
UK, and I'm just,
I think that doctors there should be a lot faster because I talked with Diana Leon because she's Greek, and
yes, yeah,
I know their case, and there are delays in scans.
yeah,
Um, I, I think uh, that's the problem that I said before. The doctors should admit that they don't know RMC. And I was lucky because in Greece, after at some point, the doctor who was responsible for Fenina said nobody in Greece knows about it. And thank God they were willing to be completely guided by Dr. Mzawel. They didn't take any initiative apart from the first 2 months that they didn't know the diagnosis. But after that, they were really, really willing to contact him. And of course, we pushed them to, to, to contact, to send the reports, because the doctors tend to maybe delay because they don't know how fast RMC goes. When they realize that, everything actually become very quickly. I mean, one day Dr. Mzawel asked for an MRI, and within 3 or 4 days, they organized the MRI. And I remember Diana saying that in the UK, it takes time for the scans.
Yeah.
It takes time to organize when they should be done, and they should be
Yeah.
done very fast and very quickly because the disease is spreading really fast.
They do know
And
that, though. The doctors do know that because of the experience, and he's being treated at the Christie. But so they do know that it's fast, but
and
it's just
maybe, yeah, but it's the problems of the system as well. The system does not want to have scans, uh, and the hospitals try to eliminate, you know, it's because it's cost for them. uh,
So, so
there's
I
always
want to
a
ask,
case like that.
I want to ask both Brian and Andre what you would say to David about chemotherapy, because you guys have done it. I mean, David can go speak to these docs, and you get these silly docs who say, "Well, it's this and it's that." And
Sorry, Rick, I have had chemo.
oh, you've had some chemo,
Yeah,
yeah.
yeah.
sorry,
Signed
I
up
had
for
it.
2 years.
Rick, yeah. So Rick's just joined after your story, David.
Yeah,
Oh,
So
okay.
he's
but
not
Rick
having
did
any
hear
more
a part of
treatment.
my
Yeah.
another question, and I can understand. I didn't tell him at that stage, so I'm sorry, Rick. I apologize. So yeah,
No,
I
it's my
did.
fault.
Yeah, I
Yeah.
did eventually have chemo. I started chemo in September 2021 and finished it January 2022. I had
Okay.
gemcitabine and carboplatin, 6
Okay.
cycles, 14, 7 days, and then 14-day rest.
Because as you probably know, and sorry to join you late, guys, but I was over in the. We have two meetings that go on at the same time here, so I sort of go into one and then come over to the other. I was in the other
On
meeting.
the phone.
Um, um, the the um, the we got two guys, Andre and Brian, who have both done well on chemo, and three guys because David, you go into that group now, man.
There's Pam. There's Pam who's just diagnosed. Who doesn't know?
Pam, you next. And
Um,
then we had, Clarissa, I was going to say we had Edward to join the call before it get too late. See if he has anything to say.
yes, you read my mind, Richie. Hi, Edward. How's it going?
Not too bad. I literally just woke up. So I was just
Oh,
like,
no.
oh crap, I missed the meeting. And then I'm looking at my Celtics get beat up too, so it's like it's not a good wake up for me right now.
Now, how do we
Now,
know
how do we know? Yeah, but how's everybody going? Haven't heard from you guys in a while.
what is
What
hyper?
what is wrong with my change? I'm sorry.
Question, Edward.
Question, Edward.
Yeah, you're getting feedback.
Yeah.
We're getting feedback from Edward.
Aisha, do you want to go first with your response? He put up himself.
I want to know how Edward is doing. I heard you was out here in Houston and then you broke out, so I just want to know how things are going with you and how you doing. Can't hear you, Edward.
Oh, you're on mute now.
Okay.
Still,
There it is. Can you hear me?
Yes, we can hear you.
Okay. Like meeting with Dr. Nasal or whatever gave me more reassurance of the current condition I'm in, and I saw that he's like really passionate, very knowledgeable about uh, what he knows about RMC or whatever, and giving me a basically kindergartner's lecture on what it is, what it does to the body or whatever was very comfortable to know from a person that's gonna have more degrees than probably my whole family. Uh, it was just good for him to like break the information down or whatever and tell me what we're gonna basically be doing going forward. And then basically giving me confirmation from when I last talked to him, um uh, him basically instructing my doctor, my oncologist here in St. Louis on what he wants to get done and stuff like that or whatever, and reassuring me that way because I felt like at some points or whatever that my doctor wasn't doing exactly what Dr. Nassau was telling him to do. Uh, but it's like once he basically broke it down to me and told me like what he wanted from me or whatever, help wise or whatever, I was like really happy about that. Got to meet Mama Richie or whatever. That was awesome. uh, for us health wise now, my body still is like with this new chemo or whatever, or the way that they changed the chemo. My body's still like really sensitive to the point where it's like my back and chest is like I don't want to be touched. But it has its days where it goes up and goes down, and I'm hoping and knowing that it's probably going to get better. I just got to give it time. I'll be back down in Houston on the 6th of June or whatever. I'll do a little blood work and get some more scans and talk to Dr. Nassau to see where we're at for as this cancer is concerning. Other than that, I had a pretty good time in Houston. Sorry I didn't get to meet everybody that was in Houston. Um, but yeah, that's about it.
All right, well that's good news. The only thing I would say is just make sure that you keep in contact with Dr. Mazal if you feel like the doctors there aren't doing or you don't think that they're listening. Just keep in contact because he'll let you know and he'll tell you what's going on and what should be going on. To just advocate for yourself and because we just experienced that and sometimes it's the bureaucracy of things. They may say that they're communicating and it may not be as frequent that you would like, or it may not be, communicating what you may like. So, just make sure that you keep in contact. Okay? But I'm glad to hear that you enjoyed yourself and I'm glad to hear that you came. It was a relief to know that you were coming. So I'm glad about that.
Aisha, Janet will stay on top of it. She
Oh,
reminds me a lot of
that's
you.
your sister. That's your sister. Okay.
Right,
Yeah,
exactly.
yeah. My ace in the
You
hole.
everybody fun. But that's good. I'm happy for you.
I also wanted to bring up on just my end. So I'm trying to put like a video together, have somebody that does editing videos. Um, and it's just basically if you guys could share like how RMC impacts you and why it matters. I'm trying to create like this powerful video. Probably going to bring it up to legislative, like kind of pass a bill, but I kind of want to make it a pinpoint, like just because you don't have the can't just because well, first of all, there are more people than there's a lot of people that do have this cancer. Second of all, just because you don't have the cancer doesn't mean you're not impacted by it. So if you guys could either send it to me on Facebook or like email me like a video. I know Lois has sent me a couple of videos, so I'm thankful for that. um so like if you guys could put like that together, like just send me that would be like helpful because then I could have more um like all our voices on this video. So working on that, and
Yeah.
I'm gonna put
So,
my email.
Teresa, would you like me to send another video um, now that because the video I sent you is with Fenina, okay,
Hmm.
and she was actually talking how RMC impacted her life, that she stopped being a champion, uh, and she missed a lot her trainings because that's what RMC does to the athletes. They prevent it prevents them from
Oh, you're on mute, Lois.
I don't know. I don't know what's going on. So, do you need me to send another video now that she left and how this whole thing impacted me as well?
Yeah,
Maybe after that, yeah, I'll see to it.
thank
Yeah,
you.
okay. So,
Yeah,
what did actually this legislator say? Actually, that why did he say that? I- Is this person somebody responsible for health issues? For
so I didn't directly talk to them, but I know Milton has been doing a lot with it, and
ah
they basically said, how many people does this really impact? Does it,
right.
really matter?
And what
Uh,
are these people? Are they members of any parliament? I mean, government people? What are these people who said that?
State of New Jersey. This is,
State. Okay,
yeah,
okay, yeah, okay.
yeah.
And actually, the unfortunate thing is that uh, all things related to cancer patients end up being measured by numbers. I mean, the more patients they are affected, the more research is done, and this is so unfair because i- it's what you're trying to promote with the video. Every single life matters actually, and things should be done uh, for everybody, for every case, no matter how many people are affected. I mean, as a number, because even a family uh, is a problem. When one member of the family is affected, uh, this is something. Okay.
Yeah, yeah, you're exactly right, Lois. And I think we just got. That's why I think the video would help, because if we kind
Yeah.
of put like that together in our voices, I feel like showing that emotion of like where this at. That's kind of one step. I know some people look at numbers and work on a number guys, and I'm an accountant, so I'm gonna work on that, and I'm working on like that aspect. So I know it's gonna take some time to look at, but I
Yeah.
So
like I
you're
know
going to crunch the numbers.
I'm gonna crunch the numbers. I'm gonna
Yeah.
break the budget here and tell them that I'm gonna look at their assumptions. So like that's what I like my plan is. And I know later I think we want to talk more I kind of strategy wise, because I know I brought up like doing grants, like trying maybe privatizing like that registry place might make sense, like to target like a hospital to or and I think we'll talk about that next time because we're running out of time. But
I was going to say,
definitely,
Clarissa, what we may can do is put together a task force so we can have another meeting separate from this particular platform.
yeah, makes sense on that. So all right, well, does anybody else have anything to say before we call it a night?
No.
I just want to say that the I missed the last meeting, but the walk was great. We
Oh,
raised a little over $25,000 after expenses, so I think we did a great job. It was great seeing everyone that came down: Clarissa, Alexa, Andre, Obrey
Yeah,
with
but
um,
that.
foundation. So we really had, and Aisha and Gregory came out. So we just made a huge day of it. So just a wonderful fellowship. I think just hearing everyone's story, and as Clarissa had mentioned, it is powerful to hear from the people. And that's what it's going to take because one affected by this cancer is too many. So there is more than people really actually realize. And then we have a fundraiser coming up on the day that Edward is coming to Houston. We're supposed to be at Fish City Grill the first Tuesday of June. So we'll be having our fundraiser then. And I think that's about it.
Well, wait a
So
minute, Miss Ritchie. Wait a minute, Miss Ritchie. Were you on a cruise during the last meeting? Is this true?
Yes, I went on a 7-day cruise, had a great time. I thought
Okay,
about
well,
you guys.
we need a report. You think you're just going to get away with telling us, "Oh, I wasn't at the last meeting"? No, we were. Or is it what happens on the ship stays on the ship?
Days on the ship. We had a wonderful time.
We don't want to know. We're happy for you,
7
Richie, but
days,
whatever you did.
7 whole
so
days, beautiful water, unlimited food and drinks.
so
Just wonderful.
Richie, your next cruise should be in the Mediterranean.
I
Yes.
know I'm planning to come to Greece next year. I got that on my bucket list, and I'll be taking another cruise in August, but it
Oh,
won't
you
be
gotta
that.
tell me when you're going to Greece because I might tag along with you there. If it,
Yeah,
Okay.
I'm actually looking at Greece. I've talked to Dr. Masal already, and
Yeah. Come all together and we'll go to Crete where Maria is.
all right. Well, we have to get together. Any RMC want to go to Greece? That's what we're planning for next year.
If
Yeah.
Dr. Tannier's going
We'll
to
organize a convention of RMC in Greece.
We can do that. What you say, Aisha?
Yeah.
I said
Yeah.
if Tannier or Dr. Mazal is going to be on the boat, then we might take you up for the offer.
We're thinking about maybe we'll just fly over there so we can spend several days over there and fellowship with Lois.
Okay, as long as the doctors are there, or at least one. Okay, then
Yeah.
we might consider it.
The,
Oh, by
the,
then
the,
Gregory will be fine. He will be
yeah.
done with this. We
The
won't have
doctor
to worry.
the doctor is Greek, so he might be for his holidays
Yes.
in
And then
Greece.
what we can
On
do is we
call.
can charter a plane to Greece. We pick up
Yeah.
Lois and Maria, and then we go on a cruise, and then we take them back and we fly back. I
Oh,
think that's the way to go.
that
As long as
sounds
he's
great.
stepping away, we're good.
Yeah.
Well, Edward
Yeah.
is the person that flies on private jets. I mean, what can I say? He has the hookup.
All right, on your coattail, Edward.
That was the fluke. Let's see if it happens again in beginning of June.
You better put it in now.
Yeah, I already have. Jenna made sure I did. I already have.
That's good.
All right, we need to let everybody get some rest. I know Anna is tired. So happy you got on the call, Anna, and I think Pam is gone. We've lost a few people, so
Thank you.
um,
It's very nice to know that you're here, and I'm glad that you came. And I hope that everything is going well with the treatment.
Okay.
Andre,
Bye.
policy words.
Bye. 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 Good night, everybody.
Good night,
Good
Andre. You gonna
night.
parting words?
Parting words. Good to see everybody this month. Looking forward to hearing good positive scan results at the next meeting. Um, love you all, and I'll be praying for you as always.
We're going to keep you lifted, as Andre says, going to keep you lifted.
We
That's
love
right.
you all. You know
We
my
love
number
you
if you
yeah.
guys.
need me.
Bye.